I'm delighted to be here today. We're going to take a look at the role of how gamification and the effectiveness of it in terms of gamifying parents, educators, carers, health professionals in delivering health and wellbeing outcomes. And I'm just going to very briefly introduce the panel that I have, because I know some of you will have seen the panelists speak earlier today. So firstly, Ben. So Ben Wilkins is CEO of the social enterprise Good Boost, which is using artificial intelligence to support tailored exercise programs. Now, Ben and I have known each other and worked together for a number of years, and it's been an absolute pleasure because his energy and enthusiasm is absolutely infectious. And congratulations again on the award. That's really good to hear. Esra we've just seen, and I had the delight of speaking to Esra earlier this week and meeting her lovely wee boy as well. So it was really nice to hear about your approach, and as we've just heard earlier. And then finally we have James, who is the head of product management at Vitality, Discovery Vitality, and he's also a trustee of a Discovery Fund, which is responsible for funding social good within and improving the lives of South Africans. So, and it's great to hear more about the approach that you take in terms of incentivizing healthcare. So really good to hear from you all. Thank you for joining us today. So I'm going to kick off, because we've only got a short period of time, with the first question. So the focus of this session is really around how carers can help or in some cases cause problems when it comes to trying to support behaviour change, as we're well aware. And so I just wanted to start with Ben and ask the first question, which is, drawing from the work that you've done, how effective do you think behaviour change is without that support network in place?
I think behaviour change is just really short-lived. Is that it's the whole thing, it takes a village to raise a child, and the reason it takes a village is because you get the reinforcement for lots of people to kind of create those right decisions throughout adolescence and growing up. And the reason why it's so important to have that group around you is because we're all human. We all forget things, and actually when we're really bad at being accountable to ourselves, often we have that little bit of chocolate cake, we kind of binge Netflix on the sofa. But when we're accountable to others as a broader group, we're more likely to create behaviours that will stick. I think one of the best examples I heard was around a cancer charity raising money, and they found if you were trying to raise money as a group, you were likely to raise twice as much. And the reason for that likely is because it's not just you raising the money, you've got other people to be accountable for to raise that money, so you're more likely to push harder to get there. So without having a community around you to create and embed behaviour change, there is nowhere near as effective and is nowhere near as long-term.
Ben, moving on to James, in terms of the work that you've done, to what degree do you feel that social support, I suppose is the technical term we use, is important in the work you do?
Yeah, I think we have seen that people operating within a network tend to have higher degrees of behavior change, but it also does depend on the profile of the person involved. So some people tend naturally to engage better in groups, and some people tend to engage better in their own accounts. So it is, however, very difficult to say that someone is operating in isolation in a vacuum. So even when our program doesn't put in structures of social support in a particular area, the place in which the person is engaging or exercising, there will be social support wrapped around that, just due to the nature of, let's just say, exercise or the family structure. And I think people are naturally drawn to that, and that's partly why something like Parkrun has been so successful.
And Esme, can you add to that in terms of some of the things that you've uncovered in terms of that social support element?
Yes, sure. And I have to agree also with what Ben and James just said. I think one difference in my situation, when people get burned out, it's actually the village that they're in that is the environment that they got, well, ill in. So from my experience within pilots, it's also, it depends on people, like, do they need support from their own environment, or maybe from people who have the same experience through the app. So in that sense, I also agree with James and also what Rita just said. Personalization is very important. So also, for example, we had a pilot with students, and they were first-year students, and they were really into getting serious about their field, and playfulness was childish. And because they spoke that out loud, the people who were struggling with stress and wanted to become more playful, they felt well, ashamed to actually use the app. So that didn't really help as a support network.
Have any of you had situations where those supporters have actually been can cause problems for the individual supporting? Because I know, for example, in the field that I work in, I've got a particular interest in cancer care and cancer support around physical activity. And it's taken a lot of work, and there's still ongoing work to get health professionals to understand that rest might not be best. And they want to wrap their patients up in cotton wool and ask and suggest that they do rest when they're going through quite challenging treatment. So I wondered if any of you had come across that.
Yeah, within MSK, I think the most recent report by Versus Arthritis said that about a quarter of people with arthritis or a musculoskeletal condition have been told by a healthcare professional to rest, not be active, which completely contradicts all the research. It's a real challenge, but not just that. There's been obviously some interesting examples within forums as well. Some moderated, some unmoderated, where forums can be a great places for peers to support themselves, but also they could become a hole of negativity. And actually, there's a real question about, should you moderate them? Because if someone is being very negative about the situation, their system, healthcare, does there need to be a moderator to kind of support that and maybe advise them for a one-on-one chat or other support services? Because that could have an impact on everyone. Or actually, do we need to be really honest and just not try to cover it up? This is just a reality of living through a health condition. People want spaces they can moan to people who also live through those experiences. So I think it's a really interesting question, and I've seen both moderated and unmoderated. Both work successfully, or both with challenges or limitations. But that's definitely where the support network could also bring the negativity within what you're trying to deliver.
Also ties back to what you were saying, Esra, about that trusted voice. Who do you trust to be part of that situation and get information from, or share your ideals with?
Yes, sorry, I'm not sure. Can you just repeat the first question? Sorry. So yeah, Mike.
Muted, Elaine.
Yeah.
I was just wondering, who is that trusted voice?
Yeah, exactly. Yeah. So that's very important even more for the people. Also, for example, the socializer who do need support. They need to find somebody they trust. We also tried having coaches in the app that people didn't know, and our players said, okay, I do want to talk to someone about my struggles to make it more real, more personal outside of the app, but I want to do it with somebody I know only.
Great.
Yeah.
Great, thank you. Moving on to my second question is, so if that social support is really important, what game elements do you think are most effective in recruiting those supporters around the individual who's undergoing the behaviour change? So again, can I start with Ben?
This will be the last question and answer. I need to run off to another thing. What we find, so we've been in a load of focus groups in the past 6 months. We do that anyway. We've been doing this for years. We've run lots of co-design, lots of co-production. We've gone completely virtual, and that's been fine for the majority of older adults with MSK conditions we work with. And we've asked them, what is it that would make them want to be part of a supporting group, virtually, face-to-face? And when we highlighted this, the thing that kept coming up is they want to do collaborative activities, and kind of the idea we've got to is things like running a marathon, climbing a mountain. How can we convert people's rehab or their self-management exercises into the equivalent of steps up a mountain, not just for their goal, but as a collective goal? Because they're all aiming for the top of that mountain. And that's been an idea that's come forward repeated times from different groups in slightly different guises. But we think that's something, well, that's something we're developing and designing now, because there's that collective goal, but also that accountability to the group.
James, how about your experience in terms of using the incentivization around the supporters as well?
Yes, I'd agree with Ben that collaboration is probably the most motivating, particularly when there are people working towards a common goal and there's certain similarities in what they're trying to achieve and how they go about it. The problem with comparison is based on who you are, you might be quite far off the norm. And if you're too far away from the norm or what you're striving for, a comparison can actually be demotivating. Whereas if your focus is on working together, there's quite a lot that the community can do to say, listen, you do your part and we collectively are going to achieve a goal. So I'd definitely say it's collaboration in our space.
So does that also cover creating, because we know from certain groups of individuals, and particularly the area working around physical activity, that there may be nobody around them who are active, because it is, as you said, it's not the normal behaviour for their peer groups. And so creating that virtual or separate or new social support might be a really important aspect of that.
Yeah, I mean, a lot of the connections we have helped our clients to create are virtual. And a lot of the people would not have actually met if it wasn't met virtually, if it wasn't for the program. And there's connections through different people. One of the challenges we do have is how do we engage people in our more rural areas where you don't have as many health facilities as many of our partners. And I think the wearable space and a lot of the engagements and gamification techniques that the various wearable companies, Garmin, Fitbit, Strava, etc., use on their platform is actually quite a good way to reach people who are geographically isolated and actually bring them to be part of a community.
Great, thank you. Esme, what about your experience? What do you think is an effective approach to this recruitment of supporters?
Yeah, so in our situation, I already said it shortly just now, is that people with burnout, they get isolated. So they are their usual support network, and they're home alone often. So I think what we do is we bring them together and we add storyline. So storytelling to give them a new kind of culture, new rules to play by, wherein stress is not like a defect, but actually a strength. And when you want to recruit supporters for that are usually like coaches, they already have an incentive to help these people. So they are more, in our intervention, more like the non-playing characters, or like in role-playing games, you just have to, I think, educate them about what is play, how is play used as an intervention, how is it used in School for Ninja, and what is my role in this story. So they are not really playing in a similar way with a similar mindset, but just need to educate them about the effect and what their value is. Yeah, and also I think what helps in School for Ninja is that players, in a game you can be anonymous, so you can have an alter ego, and that lowers the bar to actually connect with other people if you are a bit frightened to talk about your fragile situation or insecurities.
Before I'm going to move on to my last question now, but just to remind people that if you have any questions you want me to ask after this, if you could pop them into the chat box. And also, obviously, we've seen that Ben has left us, unfortunately, had to disappear off. So it will be the three of us answering those questions to our best of our ability as well. So thank you. I'll just move on to the last question. And it's about how do we keep everyone involved, engaged for the duration of the intervention? So how do we ensure that we create that long-term behavioural change that actually should hopefully last beyond the length of the intervention? So can I start with Esra for that one?
Yeah, so I think the most important thing is people have to like to engage with the intervention. I see a lot of health intervention, also the non-gamified ones, and they are quite clinical, and their employer says, you have to do this. So I think that's not good for long-term engagement. You have to really like what you're spending your time on. And then secondly, the most important thing I would say, you have to understand that it helps you. So it has to be effective, and you have to get feedback also on that, being on the progress you're making and the effect it does for you. So I think those are very important. And again, I have to I want to refer to Rita's talk. I think you have to personalize the content of the intervention, so it suits the context of the player. So I would say in our intervention, it's not only the player type that could make it personalized, but also context, as in what phase of burnout are you? Do you play your app at night or in day or from home or on the way to somewhere? So I think also that it suits your context is very important for long-term use.
And to what degree is that feedback also, for example, our parents, if you were to look at parents and other supporters or carers, do you think providing feedback to them on how the effectiveness, or does that just happening naturally through the game as they see the mental health of their caree improve?
So we actually, we do involve the professional support network, so the coach, and we also refer to the personal support network. For example, we have missions in the game, and we say, ask your parents what you were like as a kid. How did you play? What did you like to play with? So they are involved in the progress, in the missions, but I wouldn't say we really incorporate actually the feedback for the parents. I think that will be just their intrinsic motivation to connect with the player, to realize that it might help.
Thank you. James, how about your experience? What do you think needs to happen to ensure that people are engaged?
Yeah, to sustain engagement, I think there are three things. The first is habit formation. So getting people to do the desired behaviors for long enough in a regular enough way so that it becomes a habit is incredibly important. Incentives is a great way to get people started, and I guess there's debate about what happens once you withdraw the incentives. Our structure is such that we do not withdraw the incentives, but it is a debate, to what extent that would demotivate you later on. The second thing is to what extent you can integrate the activities into your everyday life. Can it become part of what you're doing? And it's linked to habit formation. So something like an Apple Watch was a really good partner for us, because people would just wear it. It would seamlessly add to their life, and the data would happen in the background. It wasn't too much effort. And I think that the third thing is, if the behaviors that you're trying to change can form of part of someone's self-image, the view of who it is that they are, that can be very long-lasting. I mean, when someone writes into us to complain about something or to raise a query, the thing that they start with is, I am a Diamond Vitality Status member, and therefore. So it is kind of part of their identity that they're part of this program, and certain things create pride. So some people have a longest goal streak, for example. They've hit 50 or 100 or 150 goals in a row. They share that on social media, and it's kind of integrated into the view of who they are, making it much, much easier to sustain that behavior.
Yeah, that embedding is so important, isn't it, as part of that process. It's got to be an habitual behavior. And I suppose the other element that I'm really interested in is that we don't live linear lives where everything is the same every day, and particularly not at the moment, although it does feel a bit like Groundhog Day sometimes. And it's that, how do we help people cope when there is a challenge or when their circumstances change, and how do the supporters come in at that point to help and support those individuals? I don't know if you have any thoughts on those elements.
Yeah, it's an interesting one. The community's got to be the right community. Health is very personal, and people have a lot of privacy concerns. I guess you take the prime example is HIV and AIDS. There's a lot of concern about privacy, but if you get it right, and if you structure the community right, and you put the right people in place to support, it can work. So in South Africa, we have medication adherence clubs specifically for adhering to medication, and that in the public sector has actually proved quite successful.
Great, thank you. I'm just looking at the chat box now to see if anyone has put in any questions. Well, I'm just trying to, so I think we've got a question here. I hope I'm looking at the right best on how to best optimize systems to accommodate people who prefer groups and people who prefer to go it alone. So I suppose that's on preferences. Have you got any thoughts on that?
I'm also looking up the questions. It's different to talk and listen and look at the chat.
It is, yes. Did you catch that one about those individuals who want that group support and those that want to go it alone? Any thoughts on that?
So for us, in our app, you could do it completely by yourself. You have the path of missions. You interact, and by interacting, we generate reflections, and they appear in a diary. And a diary you can use completely for yourself, for your own purpose of reflecting. But then we have the option, above all messages, share with the community. So that's actually, some people would like to do so and others don't. And then per mission, you can see, okay, this was my answer, but other people feel this and this and that. And it might be quite similar or really different, which might be insightful.
Yeah, so that choice is really important. Yeah.
It's just an option.
Any thoughts, James, that you have on that?
We use exactly the same approach. It's just
okay. Great. There are some comments here around when the supporters get the recognition, it can be rewarding, which, I'm sure that's definitely the case. Sorry, I'm just spinning through them now. Somebody's made a comment about understanding what drives people and try to position your motivational drivers accordingly. That's definitely the case. I think that's all the questions so far. If anyone's got any others, please feel free to put them on. So that just allows us to chat generally then. In terms of ideas on where you might take your work next, and particularly focusing in around the supporter element and ensuring that the supporters are engaged, that they're provided with maybe ongoing feedback. Have you got any thoughts and ideas around how you might consider that within the work that you're doing?
So what we are working on is adding sessions to our training. So for now, the training, it's mostly in the app, and you can choose to connect with your peers, like people who also experience stress. But we also want to organize sessions wherein people at the end of the training can share their lessons learned, but also with colleagues, for example, and HR and the organization, because they are no longer isolated and the problem, but they're now gathered in a group with some similar insights, and that can be more powerful to start change the culture for the better, make it more sustainable, healthier. Yeah.
Great. Thanks, Esra. James, I know that you've started some work in this area, haven't you?
Yeah, I think one area that we're trying to figure out how to grow and how to utilize is you get influencers or people who have their small existing circles, whatever it is, on social media or a little WhatsApp group that organizes weekend runs or weekend rides, and that actually cuts across the kind of spectrum of health and wellness. So how do we work with the people who are already quite influential in their smaller communities and get them to kind of become part of a broader or looser community? So I think if we can figure out how to do that, I think we're going to be able to leverage existing support networks to help more of our clients.
Great. So I found that we've got a few more questions that I've found in the section. So I'm just going to quickly go through that. So there's a question here for you, James, around presumably the user's insurance premium cost decreases when they're healthy and decreased insurance repayments. Does that impact on profit? So it's quite specific to your piece of work.
Yes. So interestingly, in South Africa, we have a law in health insurance that says you have to pay the same amount for the same healthcare cover. So we cannot discount health insurance, but we do discount life insurance. And you get discounted life insurance based on, whether you're on blue, bronze, silver, or gold or diamond vitality status. And that can actually be worth quite a lot of money every year. So in the healthcare space, it's more about making the medical scheme sustainable. So you're reducing healthcare costs for the scheme, which is actually technically a non-profit. The scheme then becomes more sustainable. You can lower the medical aid premiums across the board, and that's just beneficial to all of your clients. In terms of the rewards impacting our profits, it's actually the other way around, because the return on investment in terms of improved mortality and improved morbidity is so profound that we actually get that return back on all the money that we spend to incentivize behavior. So the life insurance business is very profitable because our medical scheme is so sustainable. We've grown to have captured more than 50% of the open medical scheme market in the country, because benefit, we can make it much more cost effective. Yeah.
Okay. Thank you, James. We've got a question here around, and I'm not sure if any of you are aware of examples of network support, in particular relation to COVID. Have any of you come out across any of that? It might be that one for some of the individuals who are involved in that area of work might be able to come back and answer on if they put it in the chat box. Great.
Yeah.
I know, Jim. Sorry, go on.
Sorry, I have not come across any examples of network support doing that, but interestingly, we have got quite a lot of data showing that the more physical activity someone does, the more resilient they are to COVID. The less likely they are to catch it, and if they do catch COVID, the less severe the complications are likely to be. Yeah,
I think that's a really interesting area. I was at another virtual conference just recently, and the evidence around the impact of physical activity, not just in terms of the increase in immunity, as it were. There's some emerging evidence around that, but also for a lot of individuals who are catching COVID, there's a real challenge because they have underlying health conditions, and again, physical activity can impact on that. So I think there is definitely something in that as well. So I'm going to have to close the session up. I want to, because we're just about at time now, but I want to thank you both very much for engaging in this session today. And it's been fascinating hearing about your work, and just to wish you well in your future developments of your products, because it's great to see more and more approaches being used to incentivize and to support and encourage behaviour change. And I look forward to hearing more about both of your successes going forward. So thank you very much to you all. Thank you to
Elaine.
everybody who listened in on this session, and I hope you found it as interesting as I did.